In a hospital, two patients were admitted on the same day. In a week's time, patient A was discharged while patient B was kept in the hospital for the next 3 months. What difference did you observe between the two? Was it the duration for which they were hospitalized? Yes, clearly the difference is a lot. Patient A suffered from a disease of shorter duration and patient B suffered from a disease of a much longer duration. But why did this happen? Did you know that diseases too can be classified into various types? We can classify them on different bases. However, let us look at the first type of classification. The disease suffered by patient A was not a severe one. It took lesser time to be cured and the patient was healthy again. However, patient B suffered from a serious disease and it took a very long time to be cured. Diseases which last for a short duration are called as acute diseases. Diseases which last for a long duration are called as chronic diseases. A common cold will be an acute disease, while tuberculosis will be typically classified as a chronic disease. If you take leave for 1 week off school, you wouldn't miss out much as compared to 3 months of leave, don't you agree? Similarly, acute diseases do not cause much damage, whereas chronic diseases generally cause severe damage. The body is damaged severely and it has a drastic effect. This was the classification of diseases based on the duration of the disease. How about learning another type of classification? Do you recollect your siblings or some family member falling ill after they have taken care of you? You probably had fever and the microorganisms in your body may have attacked your family member. Such diseases caused by microbes or microorganisms are called as infectious disease. The microorganisms and microbes which cause these diseases are called as infectious agents. What do we mean by agents? Agents are those that have a capability of spreading diseases from an infected person to a non-infected person. Infectious diseases can spread as they are caused by infectious agents. What about non-infectious diseases? These diseases are not caused by any agents, so they cannot spread. Non-infectious diseases are mostly genetic and therefore passed down from generation to generation. If a patient has a family history of diabetes, there are chances that he too may suffer from it. But a friend who sits next to him will not contract his disease because of him. So diseases can also be classified on the basis of their causative factors. In our next lesson, we will look at infectious agents in detail.